so much, Madam Secretary. I really appreciate your kind introduction, and we all, again, thank you for coming to Pittsburgh. As a longtime consumer advocate based here in Western Pennsylvania, and now as a member of Pennsylvania AARP's Executive Council, I am here today proudly representing AARP's almost 2 million members in Pennsylvania and AARP's almost 40 million members nationally. I'm delighted to be part of this event to address healthcare-related crimes that directly affect our most vulnerable senior citizens, as well as everyone else's healthcare costs. I have literally spent decades educating consumers on a wide variety of issues that help them from being taken advantage of in the marketplace, enabling them to get the most bang for their buck when they spend their often limited income and savings. Along with other members of Pennsylvania AARP's Consumer Issues Task Force, I am currently being trained as an active participant in the Senior Medicare Patrol. In 2009, according to a report from the Government Accountability Office, it was estimated that approximately 10% of all healthcare spending, or about $100 billion, came from fraud and abuse. The Centers for Medicare and Medicaid Services estimates that we are losing about $65 billion a year to criminal fraud. That's our money. Money lost to fraud is simply money down the drain. The best defense against fraud is educated consumers who know how to recognize, resist, and report fraud to the responsible authorities. AARP is known as being the gold standard for providing credible and easy-to-understand information to educate the age 50-plus community and their families. AARP is working hard to shine a light on healthcare fraud and its impact on all Americans. At AARP, we hear stories about Medicare fraud manifesting itself in the form of medical services being billed that were never performed on the patient, and medical supplies or prescriptions being billed that were never received by the patient. Some of you may be wondering what you can do to prevent yourself from becoming a victim of healthcare fraud, and I would like to share with you just a few brief tips. Protect your Medicare or Medicaid card number in the same way as you would protect your credit card or bank account number. You know, we often have red flag moments in our lives. One of those is never give these Medicare or Medicaid numbers or any details to people who phone you or show up at your door asking for such information. Don't be afraid to say no to these people. Remember, you are in control. Always depend on your own doctor to recommend all medical services. Don't let anyone talk you into buying something you don't understand or may not need. Be wary of those who tell you it won't cost anything because it's covered under your insurance or Medicare. Never give your Medicare or Medicaid number to anyone offering a free medical service or item. Your number is simply not required for something free. Keep a calendar of all your healthcare visits and services. Compare your calendar to the dates and services provided in your Medicare summary notices. Those are the "this is not a bill" Medicare statement that you receive from CMS that outlines what costs you have incurred and what your insurance has actually covered. Don't be afraid to ask questions, and then ask more questions. Use the resources available to you to get answers. AARP has a list of phone numbers you can call for assistance in that regard, and we have those available today to anyone who wants one of our lists. Secretary Sebelius is leading the way in providing innovative efforts that will help to stop fraud and prosecute the criminals that are costing us billions of dollars a year for fraud and abuse of the system. I want to invite you all today to join with me and Secretary Sebelius in becoming advocates to help fight against Medicare fraud and to report wrongdoing when it is found, so that the people perpetrating those frauds can be held accountable. Always remember that even one person doing the right thing can make a difference for us all. I thank you all, and thank you again, Secretary.